So
This
please mute and
conference will
unmute
now be
yourself by using the
recorded.
*6 on your phone or the microphone icon if you're logged in online in the GoToMeeting app. If you have any questions during the discussion, feel free to use the chat box in the GoToMeeting app on the right-hand side, and we'll be sure it is addressed or follow up with any information post today's session. So today's focus will be related to the FFCRA legislation as it pertains to the EFMLA, good old alphabet soup, and the exemption provided to healthcare providers. We're also going to highlight the extension of the federal public health emergency and the latest on the Medicare Advance Payment Program and round 4 of stimulus. So with that, I want to hand it over to Mike, who's going to get us started with the latest on HHS relief funding. Mike?
Yeah, thanks, Jason. I'm going to run through this stuff real quick and leave the vast majority of the time to Michelle. Real quick, kind of things that have gone down since the last call we had, which I believe was 2 weeks ago, was if you see the first bullet there, the two things. One, the Medicaid portal, which they're calling the enhanced portal, which was for the non-Medicare but Medicaid providing, providers. That it originally was supposed to close 7/20, and due to some feedback they had, they extended the portal opening through August 3rd. In addition to that, they added dentists to that well, and so those they still have a few days to put in their information for that, and like everybody else, it should be 2% of corporate tax return top line revenue that was on the tax return for any who haven't done it. And so for those of you who either are hospitals and you have independent pediatricians or OB in the market, continue to encourage them to go out and participate. If you are an independent physician that did not participate in the Medicare round, that's for you, and so go do it. The safety net, the targeted distributions came about 2 weeks ago, 2 to 3 weeks ago. The only reason I still bring this up is that it had 3 criteria on it that were uncompensated care cost based, a percentage of profitability based, less than 3%, and then a third criteria for their disproportionate share percentage. And then later on, they did a second round for any that didn't make it on 1 year of profitability, but made it on 2 out of the past 5 years. We now have three of our hospitals who did not get in either one of those 2 rounds that are in the process. There wasn't an official HHS appeal process, but are appealing it through federal legislative angles. And so if you're in that boat where you're a PPS hospital who feels like you met the criteria, or really the spirit of the criteria, then I would encourage you to holler at us and let's follow the same process that those guys are going through. Whether or not they get it or not, I don't know, but I will give the Senator Loeffler's office kudos. Their feedback and their prompt back and forth has been very helpful. Nursing home, there's a targeted distribution coming for that. If you have a nursing home, they should qualify for it. It's a $5 billion. If you have one and you got the money recently, sing out. We had not been aware that the money had come through last Wednesday, when Wednesdays are the days that the money tends to drop from HHS. And so if you have any feedback on that, then sing out to us. But we believe that is forthcoming. And then the operational details, and if there are any profitability requirements or anything like that, we had not seen that released from HHS yet. One other important requirement that has come out in the last 2 weeks, although there's really more to follow than there is to play with right now, for anybody that got more than $10,000 in HHS money, there is a statement that you're going to have to report how you spent that money through the 12/31 spending. Needs to be reported by February 15th of 2021. And then in theory, the rest of any funds that you had would be spent out and reported by July 30th. Again, there's a lot to come in the details of that are supposed to show up by August the 17th. Our concern is that the way it was written, and I've told several of y'all this, it looks like it's a reporting of expenses. And we're not entirely sure that when the bulk of y'all, when the issue is lost revenue rather than increased expenses, that was the pain you felt. How do you turn that into an expense statement back to the feds? And so hopefully that's clarified on August 17th when that occurs. And so we will devote probably a full session to that once we have a chance to digest it and then get some feedback from you guys about how you'd be attempting to comply with that. Michelle, anything to add to that? Or are you kind of equally up in the air as we are on that?
Yeah, we're just waiting at this point.
Yeah. It looks like by our math that there's 5.4 billion left to distribute. We kept saying that we believed a critical access round of 5 billion was coming. I don't know anymore. And so we have, when we reached out to Senator Loeffler's office and then our best legislative contact, both of them gave us the same information, that HHS had sort of frozen out the conversations around that and had told them nothing in the past 4 weeks. And so they didn't have anything new for us to share. And we hope it's still there, but we don't know at this point. Next slide. We had been saying on our last two presentations to you guys that the extension of the public health emergency was forthcoming, and it finally did officially get pushed out to October the 25th. And so specifically, what does that mean? It's the same points we've been making generally. All the expanded telemedicine coverage that you're experiencing right now, and telephonic coverage that you're getting, that you can do and be paid for currently, all of that continues through October 25th. The higher reimbursement for telemedicine continues. The extra 20% for the COVID and inpatient admissions continues. There was a neutral site payment policy for LTACs, and then the waiver of the 3-hour rule for inpatient rehab. All of that continues to be waived, or the additional payments made all the way through October the 25th. And so, shouldn't be any issue with continuing to be paid for that. Next slide. In the bad news category, we believe we've sort of run the strings, at least so far, on the Medicare prepayment. We had been sort of asking everybody to hang tight. If you got one, we've been playing this game about whether or not some federal legislation was going to come through and forgive that. And so, we had been sort of counseling people to hang tight. Unfortunately, it's not overtly in the Senate or the House version that are out there. And so, and it feels like at this point that the odds of separate legislation for that, the House Bill 7292, to follow its way through the process, given the other two bills out there, feels low. And so while the other advocacy groups are still pushing for it, it doesn't appear that we have a line of sight to getting relief for that. So that said, the last 2 or 3 conversations, we've been talking about how do you pay it back if you want to, or it is a free loan. And so if you want to let it push through the recoupment process, you can. But as of the date of the recoupment starts, which would be 120 days after when you got the money, that they can take, or they will take 100% of your Medicare reimbursement through the time that your prepayment is funded back to them. And so whichever way you choose to do it, we have two schools of providers. One that don't want to get into the reconciliation process for the recoupments in the first place and kind of see that as a pain in the rear to do. Others that see it as the extension of a zero interest free loan and playing it out in the reconciliation process as a small price to pay for being able to hold that money for a certain period of time. But however you fall into that, 2 options for repayment. Like we were saying, one of them, they're strongly encouraging no checks, send it back to the e-services, e-check mechanism that's on the Palmetto website. If you need instructions around that, contact us. We'll shoot that back out to you. But otherwise, you'll be following through the recoupment process that'll start. So their first recoupments have started, just not, for most of y'all that sort of told us that you got your money around April 10th through the 15th, your time is still, now it's, 2 weeks away. And so, let us know if you need help making a decision around that, but that's kind of where that stands. Next slide. Next round, it looks like, this probably is not new information to any of y'all. The House HEROES Act got passed well over a month ago. As I've said many times on here, McConnell announced it dead on arrival in the Senate. As soon as it got over here, the Senate HEALS Act is not Senate approved yet, but in theory, y'all heard what we did about the White House and Senate coming to agreement on that. The key provisions are a second round of direct stimulus payments, new unemployment benefits to continue after the 7/31 run out of the $600 payment that would be based on 70% of lost wages, start at 200 a week and increasing over 500 a week, but topping out at 70% of current wages for a current employee. A new round of the payroll protection program for businesses less than 300 employees that could demonstrate that they've lost more than 50% of their revenue would be a second bite at the apple for the same employers if they chose to do it. But you'd have to do it. That's a pretty, I know there's some businesses out there, most of our practices and all of our hospitals probably have not experienced a 50% loss of revenue, but nonetheless, that's what it's geared toward. And then just like the state of Georgia, some virus lawsuit shields for businesses and doctors, schools to give relief against being sued for catching COVID in your establishment. And then 105 billion earmarked to help schools open. And then you see the last bullet point there. There's 26 billion toward vaccine development, 16 billion to help states boost testing capacity, but no additional direct provider relief. No more lost revenue or pushed out into the farther into the future interruptions of revenue funding mechanisms similar to what we talked about before. As y'all recall, the HEROES Act replenished the HHS funds back up to 100 billion and would restart the process of going back through those, but not on the Senate side at this point. All right. With that, I'll pivot over to Michelle. But Michelle, before you start on your part, any more about kind of next rounds of stimulus that you've heard that I missed?
No, I think you covered it.
Okay. All right. Well, I'll toss it to her. Next slide, Aaron.
Okay. So we're going to talk about the First Families Coronavirus Response Act, which came out back in March. So we can go to the next slide. There were multiple parts of this law. So what I did today is I broke down the different parts about the Emergency Family Medical Leave Act benefits and then the Emergency Paid Sick Leave benefits. So we can talk about both of those. And then the exemption for healthcare workers, which is incredibly broad, as well as the exemption for emergency responders. And then I've included some examples and some hypotheticals in this presentation as well that we'll get to, because I know based upon where you are, we are facing school may be opened, it may be partially virtual, partially in person, or it may be delayed 9 weeks. So I've included some examples about what we would need to do as healthcare providers. And just so as you all are aware, this law did come out on March 18th. It went into effect on April the 1st. And I'm going to focus on two very specific sections within that law. So let's go ahead to the next slide. So I'm going to start with the Emergency Family Medical Leave Act, because as you all know, if you have a certain number of employees and the employees fall within a certain type of illness, or there is a serious health illness where they're caring for someone else, they can take family medical leave, and generally those benefits are unpaid. They're out for up to 12 weeks and can be intermittent during the year. We've all worked with that over the years. What this law did is it added one more provision and actually expanded who the Emergency Family Medical Leave Act would apply to. So instead of it being an employee who's worked at least so many hours per year and so many weeks per year, it actually means any employee that you have that's been employed at least 30 calendar days. And so think about all the employees that you have. If you hired anybody in the last 30 days, they would not be eligible, but anybody prior to then who have had an employment for 30 days or more would be eligible for this. And Remember, I'm going to talk about eligibility, and then at the end, I'm going to tell you about the exemption. So don't worry until I get to the exemption, because I think everybody on this line is probably eligible for the exemption, and I'm going to go through how it works. But just from a standpoint of if you were to have your employees participate, it would be your employees that have been with you at least 30 days. And this law does apply to employers with fewer than 500 employees, which a lot of people thought was strange. Why are we saying to the smaller employers of less than 500, hey, you've got to provide these benefits because that's a cost to that employer? And the other side of that, from the government standpoint, when they passed this law, is their thought pattern had been larger employers with more than 500 employees already have robust sick leave and paid time off leave policies, as they felt like it would cover the employees in these instances. And so they were focused on what they considered smaller employers, 500 or less. That was the reasoning that they used as to that threshold, which I thought was interesting, because I think a lot of us have similar PTO policies and sick leave policies. Let's go to the next slide. The qualifying event under the emergency family medical leave, and one of the reasons why I included all this information from the law is so that you have it as a resource in your office, and it's important because under this law, so this extension of family medical leave, it's only applying to the instances when you've got an employee who cannot work and cannot telework. So think about all your employees who went home to telework. They would not be eligible for this. So they can't work and they can't telework due to the need to care for a son or daughter under the age of 18 if the school or the place of care has been closed or the child care provider is unavailable due to public health emergency. So let's go to the next slide, because I want to give some details about what does all this mean. Because some of us think, okay, well, I've got employees and they're telling me that they have to stay home to take care of their son or daughter because their school is closed. Well, the next question is there someone else that's available to care for that child? Is there someone else in the home who could stay with the child so this person could come to work? So a child care provider means any provider who receives some form of compensation for providing care. And I just saw some emails this past week with school being delayed, and I don't know if this is happening in your regions. Some of the colleges are going virtual as well in the beginning, and there are college-age people, obviously over the age of 18, who are willing to provide care for these children when their schools are virtual so that the parents can go back to work. So I've seen emails about that, which would also mean that they're not eligible. It's not a qualifying event because you have someone over the age of 18 that you could pay to take care of the child. And then the other thing that I'm seeing are neighborhoods, and this may be more in the urban areas, but neighborhoods where the families are coming together and they're rotating one parent out of, let's say there's 6 households, and that parent staying home with the kids while they do virtual school, which is an interesting way of doing it. But that would also mean there is someone there that's caring for that child. Let's go to the next slide. From an eligible healthcare or child care provider, because we get lots of questions about, well, my kid goes to preschool and the preschool is not going to open. Well, preschool is considered a child care place. So if they don't have anyone else to care for their child, that may be a qualifying event. Otherwise, it's a place where children go and it is registered by state law as a child care provider. It could also be someone who's over the age of 18 who provides care to children, and either they're related to them by marriage or they're related to them through their family, or there's a court decree, so there might be a custody or a foster child, or it's the grandparents taking care of the children. So if any of that is available for that individual employee that you have, they technically wouldn't qualify because they have someone who can care for that child so that they could come to work. Let's go to the next slide. School means elementary schools and our secondary schools. Again, it's for children under the age of 18. And so when you look at the language, what it really says is your son or daughter who's under the age of 18 and the school is closed, or where they go to school or where they get child care is closed, and you don't have anyone else who is available to provide care due to the public health emergency. So son or daughter includes stepchildren, it includes foster children. And then the definition of school is both elementary and secondary schools. So it does apply to both. Let's go to the next slide. So here are the benefits that they receive. So let's say that I've got an employee, and let's say that her husband works and she has 3 children, and they are all between the ages of 6 to 13. and they go to school, and the school has decided to delay school 9 weeks, so it'll be virtual only. Her husband's not available to care for the children. Her parents live in Idaho. She has no one else to care for the child, so she would ask for emergency family medical leave benefits to stay home while the children are in virtual school. Now, with that said, staying home, could she telework? So the question is, based upon her job function, is it possible for her to telework? Is it possible for her to telework partial days? I know when my children were home with virtual school, some of their courses, actually their entire day, was done by 11 a.m. because they received their assignments and they were finished. And so then in the afternoons, I didn't have to worry about, am I doing geography classes today? They were done by that point in time. They could go do independent things, and I could telework in the afternoon. So if it's possible to telework even intermittently, you would not have the emergency family medical leave. But what the benefits are is, let's say that I did have to go home, or that employee had to go home and care for that child, and we are not exempting them at this point. Then after the first 10 days, which is not paid, unless you have a PTO policy and you want to let them use their PTO policy for the first 10 days, you can do that. But otherwise, under these benefits, they're not paid for the first 10 days. And then after that, it is 2/3 of their regular rate of pay, so their hourly rate of pay, 2/3 of that, capped at $200 per day, up to a maximum of $10,000 over 12 weeks. So remember, the benefit of emergency family medical leave and the normal family medical leave law is you have to keep a position open for someone for those 12 weeks, and that you have to restore them to either their position or a similarly situated position that has the same or equivalent salary and types of job functions when they return. And that would apply here. The difference between our normal family medical leave and this family medical leave is the other one's not paid for unless you have some policy in your organization where you provide benefits during that time period. But by statute, it's not paid for. Here, you would be required to pay for it. However, on this employee, let's say we didn't exempt them. Let's say we told the employee, please go home, take care of your 3 children. You'll get paid up to $200 a day. We'll keep your job open for 12 weeks, up to $10,000. When you go to file on your 941s for that employee, you would take a tax credit, a payroll tax credit, up to the amount that you paid out for that employee. Not their normal PTO that they normally have, but the payments that you made under this benefit. So let's go to the next slide. The exemption, and I'm going to get in details on this after we talk about paid sick leave, but the exemption language is that certain healthcare providers and emergency responders will be exempt from the definition of an eligible employee. And then employers who have less than 50 employees, so we may have some physician practices on the line with us today that have less than 50 employees. If you believe that imposing these types of benefits on your organization would jeopardize the viability of the company as a going concern, then you can also exempt your employees even if they weren't healthcare providers, although the way the Department of Labor defined healthcare providers, it's so broad that it likely encompasses your employees as well. Let's go to the next slide. So the healthcare exemption, again, anybody who's a healthcare provider or an emergency responder can elect to utilize this exemption, and it's by employee. So it's when your employee asks for this benefit and then you talk about the fact that they're exempt because they're a healthcare provider. Let's go to the next slide. So I want to talk about the paid sick leave, and then I'm going to jump into the specific definition of a healthcare provider and an emergency healthcare provider because it applies in both instances. There are exemptions under both laws. So let's go to the next slide. So this benefit for the employee, so this is all of your employees, doesn't have the requirement that they had to be employed by you for the last 30 days. It's going to apply to both full-time employees and it's going to apply to part-time employees. And so for full-time employees, and I'm going to go through the examples of what is considered eligible for sick leave, emergency paid sick leave. For full-time employees, they would get 80 weeks paid, and the rate depends upon the reason that they would be taking sick leave. And for part-time employees, it's based upon their average number of hours. And if you had somebody that was just doing random hours from time to time, they would actually look back at the last 6 months to determine what was the average hours, or they would look at the number of hours that person should have received when they came on board. So when you hired them, what was the expectation of the number of hours per week that they would have worked for you? So they'll either look back 6 months or they'll look at what did that person expect when they came on board. Let's go to the next slide, please. So we do, as employers, even if we're going to exempt out our employees, we do need to realize that we have to publish the notice of these benefits. Now, when this first came out in the very beginning, we just emailed out that notice because all of us were at home. We were under the shelter-in-place order. We just emailed out the notice. So the Department of Labor has prepared a notice for all employees about these benefits. We should have sent that out the first week of April. If you didn't, please publish it in your office. Please make sure all your employees are aware of it, even if we are exempting. And then we can't require our employees, if we're going to offer them emergency paid sick leave, we can't tell them that they have to use their PTO before they get the emergency paid sick leave. It is a benefit that happens before they start dipping into their PTO. Let's go to the next slide, please. All right, so if the employee is unable to work or telework for one of these following reasons that I'm about to tell you about, then the emergency paid sick leave can kick in. So let's go to the next slide to talk in detail about what actually triggers it. So you've got an employee that's subject to a quarantine or an isolation order by the government. Okay, so the government comes in and says, in our city here, we have a huge community spread and everybody has to be in isolation. We haven't had that happen yet, but if that were to happen, then that employee would be eligible for emergency paid sick leave. If there's a healthcare provider who says to your employee, you need to self-quarantine due to concerns related to COVID-19, and where I've seen this the most is where we have employees that might have comorbidities. So they might have some other, either diabetes or some heart condition, or they're an oncology patient, and their doctor says, I need you to self-quarantine. I can't have you going to work. And so in those instances, they would have an order by a healthcare provider that they've been ordered to self-quarantine because of issues related to COVID-19. Or if the employee is experiencing symptoms and is getting a medical diagnosis, they would be eligible for emergency paid sick leave unless we exempt them. And so they do have to get a medical diagnosis in order to be eligible for this emergency paid sick leave. So let's go to the next slide and let's talk about what they actually get if they fall into one of these three buckets. If it's related to actual self-quarantine, isolation, a medical diagnosis, then we would pay them, if they're a full-time employee, for the 80 hours that they were out, up to a maximum, based on their rate of pay, up to a maximum of $511 per day, and a total cap for that 80 hours of $51.10. Okay, so that's the benefit if it falls into one of those three buckets. Let's go to the next slide, please. If it falls into one of these buckets, the rate is different. So if the employee says, hey, my husband has been tested for COVID and he's been put on an isolation order, and so I need to care for him at home, then they may be eligible for emergency paid sick leave. If it's my neighbor down the street has COVID or has been ordered to isolate and I need to care for them, that does not apply. It needs to be someone in the immediate family. The employee is caring for a son or daughter whose school has closed, so this is under our family medical leave, and now the school is closed because of COVID-related issues, then they could get emergency paid sick leave if they are caring for their son or daughter, the school or the child care provider is not available, and it's due to COVID-19 reasons. So they may be also eligible. Or there's this catch-all that they put in the law that basically if you're experiencing a similar condition to COVID-19 and you're having similar circumstances to what these exemptions are, what these reasons are for qualifying, then they'll also allow you to get emergency paid sick leave. But the benefits, let's go to the next slide. When you're just staying home with someone who you have to care for because of an isolation order, let's go to the next slide. Or if you're caring for the son or the daughter. Jason, can you hear me? Of someone who has to be cared for, your benefits are only going to be 2/3 of their hourly rate, and it's going to get capped at $200 a day. So Mike, can you move it to the next slide for me?
Aaron, Jason.
Just a moment. I think Aaron's internet froze.
There you go. Okay, so that's our benefits. 2/3 the rate of pay, $200 a day, $2,000 in the aggregate. So it's a lower amount. Again, same concept. Let's say we say to the employee, okay, you've got to go home, care for your husband. There's nobody else to care for him. He's under an isolation order. So you go home, we're going to pay you 2/3 of your rate of pay, up to $200 a day, not to exceed $2,000. And then you also file that on your payroll taxes as a credit. So you get a credit for that $2,000. Let's go to the next slide, please. Again, you're exempted if you're a healthcare provider. So I'm going to get into the nitty-gritty details on this part. Let's go to the next slide, please. So exemptions under paid sick leave are healthcare providers, emergency responders, unless we opt out, small businesses with fewer than 50 where we jeopardize the viability. So that's the same as the emergency family medical leave. And then as necessary to carry out the law. So it's a broad exemption that basically you take legislative action. Okay, let's go to the next slide, please. All right, here we go. All of these types of facilities are considered healthcare providers. So when the Department of Labor put out the definition of healthcare provider, they specifically said that a healthcare provider is anyone employed at any of these facilities. It includes doctors' offices, hospitals, healthcare centers, which is a broad term, clinics, educational institutions that teach healthcare. So think about medical schools, a medical school, the local health department, a nursing facility, nursing homes, retirement facilities, home healthcare providers, and any facility that's a laboratory or is a pharmacy or anything similar to those that's an employer or an entity. So that's about as broad as you could possibly get. And then they went further and they said, not only does it include anyone who's employed at any of these facilities, it also includes anyone that contracts with any of these types of institutions to provide services to maintain the operations of that facility because their services are going to be needed. So the concept from the Department of Labor standpoint was, let's go big, because we need to make sure we have healthcare providers available to provide care in the community. And our direct caregivers can't provide care unless everyone in the office is available to support them. So when the Department of Labor put out this exemption that said this is the definition of healthcare providers, Congress got very worried and actually a little upset because they felt like it should be a narrow exemption. They were trying to expand benefits for individuals. And so they actually tried to change this definition under the Department of Labor through the HEROES Act that never got passed. So on May 15th, when they passed the HEROES Act, they actually had rules in there that would have narrowed this exemption, but it didn't pass. So today, we still have this very broad definition of what's a healthcare provider. So when we look at our offices, front office staff who are not clinical, they are employed by a doctor's office, you could exempt them under this law. Now, what the Department of Labor did say at the end of this is we don't want the spread of COVID-19 to continue. Our goal is to put in place mechanisms to prevent the spread. And so they encourage employers to be very judicious in how we use that definition of a healthcare provider and how we use the exemption. So let's go to the next slide. So I put in bold to be judicious because they were very focused at the end of their definitions of healthcare providers and emergency responders that they wanted us to make sure that we didn't exempt everybody, that we exempted the individuals that were needed for the operations of the healthcare facilities. And obviously that list of healthcare facilities was incredibly long. So they did give this example, which I've included directly on the slide here, is you could say to someone, okay, I'm going to exempt employees from leave for caring for a family member, but if they have their own COVID-19 illness, then I'm going to give them the benefits under the paid sick leave. Because remember, family medical leave is only for caring for a child when your school is closed. Paid sick leave addresses when you have to go home to care for someone else that has COVID or you have COVID. And so they said maybe you exempt them from part of it, but not all. So that was one of their examples that they gave. Let's go to the next slide, please. So I included a couple of examples here because we really are faced with all kinds of things. I've seen all kinds of facts and scenarios that have hit us since April the 1st. So this is one that the Department of Labor actually tackled where it's an employee, they become ill with COVID, they decide to quarantine themselves for 2 weeks because, you know, that's what the CDC kept telling us. Stay home, don't come to the work for 14 days, make sure you don't have any symptoms. But they never actually go to a doctor because, you know, having that test done supposedly is terrible. They don't seek a medical diagnosis and they don't go to the provider, but they want to get paid the 80 hours of the paid sick leave. And the answer from the Department of Labor was, you're not eligible, because the eligibility for receiving that benefit means you got a medical diagnosis from a healthcare provider that required you to self-quarantine, not that you self-imposed a self-quarantine. So I know some of you have employees that have said, I went to a barbecue on July 4th and found out a week later somebody had COVID, so I'm just going to stay home for the next 14 days. They would need to go to the doctor to get the medical diagnosis to be able to receive these benefits. And if they work for any of you that are a healthcare provider, you can exempt them from getting those benefits. Now, obviously, we don't want employees coming into our sites that have COVID, but addressing those that don't have COVID but may be self-imposing restrictions. Let's go to the next slide, please. So here's one where the employee has been exposed to a positive COVID patient and they decide to self-quarantine, no medical diagnosis, and there's no physician order. So that's what we had just talked about. And I think what's really important here is exposure. So the definition of exposure has changed over time. So the last definition that the CDC put out was you're around someone who's not wearing a face mask for a time period of 15 minutes or more. This is going to change as we move forward. So just making sure that you have a policy in your office about how do we handle individuals who say, I've been exposed to a COVID-19 person. And there are different things that we can do. You may have a policy that says you have to go home for 14 days. Working in a law office, we have to fill out a questionnaire, and I'm sure your employees do too, every time we walk into the building. And it asks us, have we been exposed to someone with COVID in the last 14 days? Have we had any symptoms related to COVID, which is a much longer list now, in the last 14 days? Have we been social distancing in the last 14 days? And we have to answer all those questions. And in a law office, if we're allegedly considered essential providers, not healthcare providers, but from the infrastructure side, we could have a policy that says if you've been exposed, then you go home. If we had less than 500 employees, we're not healthcare providers. We may have to provide a benefit to those individual employees if they went and got the medical diagnosis. But if we just had a policy that you go home and there's no medical diagnosis, then we would refer to our PTO policies and our sick leave policies, which was the intent of the second part, is if our policy is you go home if you've had any exposure, then you would look, if you exempted your employees out because you're a healthcare provider, they would go to their PTO and their sick leave policies. What I think is, yeah, go ahead.
Do y'all have any policies that y'all have sort of pre-written that can be customized for folks, or is that something that they could ask you to help with?
Yeah, we've drafted a lot of return to work and then also our policies on the healthcare side. The other side of this about healthcare providers, and you all are unique, is that you're part of the critical infrastructure. And so the CDC has different guidance for the critical infrastructure. As healthcare providers, if your worker has been exposed but they're experiencing no symptoms, under the CDC guidance, they have no symptoms, mind you, again, no symptoms. They could come back to work, wear a mask, and take the temperature, and you monitor them. And once they do have symptoms, they'd immediately have to leave, obviously. But there are policies that we have very specific to what the CDC recommends for healthcare providers and employees that may have been exposed but no symptoms. So yeah, we do have that. The other part is, as healthcare providers, if we're going to exempt our employees from these benefits, we also want to make sure that we're taking proactive steps to try to prevent the spread of the virus, because that's what the DOL and that's what this law was intended to do, was to have people outside of the clinic if they have been exposed or they have symptoms. So making sure we are doing this survey of our employees and that we're taking temperatures of our employees either at each shift or in the beginning of the shift, even your front office, your registration, everybody. I spoke with an infectious disease physician a couple weeks ago, and his recommendation was if you're a healthcare provider or you're working in a healthcare setting and you either have patients that have been in the office that had COVID or you've been exposed to COVID in some other setting, that you actually take your temperature twice a day. So in my nursing homes, they're taking them every shift change and every 4 hours. But in some of the physician practices, we might be taking them twice a day just to monitor those employees that may have had some exposure to somebody who had COVID. And obviously we're having a surge of COVID positive results today.
And Michelle, that's Jason. On that note, we've had a practice inquire about this. If an employee has tested positive, any obligation by the practice or the providers to notify other patients?
So the CDC, there's two ways to deal with this. The CDC's guidance about notifying patients, there is guidance that we should notify the patients that would have had direct exposure to that healthcare provider within, and I'm going to go by memory right now, but within 48 hours prior to us receiving that positive test result. The other option is whoever did the testing on the individual employee, they're going to report to the Department of Public Health, and the Department of Public Health is going to come back and do contact tracing. But there is guidance that we should at least notify the patients who had direct exposure to that healthcare provider 48 hours prior to that diagnosis being confirmed. There are specific templates that the CDC has used in other instances of communicable diseases and other kind of spread of diseases that are helpful. And I would recommend looking at that, because you don't want to alarm your patients, but at the same time, we need to make sure that they're looking for symptoms, and we need to explain to them whether it was a low risk or a high risk based upon their exposure to that provider. One of the other questions that we got is if an employee is told to go home by us because they've been exposed, but they didn't get an official diagnosis, would they be eligible under this instance? And here, according to the Department of Labor, if we send them home, it doesn't automatically make them eligible for emergency paid sick leave. It takes the isolation order, or it takes a medical provider saying you need to self-quarantine in order for that emergency paid sick leave to kick in. Right, let's go to the next slide. All right, school. So this has been, I know, difficult for everybody, and we're all over the place on school. In some instances, our schools are saying it's your choice. You can do virtual or you can come in. We will be here and we'll be open, or you can do virtual. In that instance, the school is not closed. So the individual employee has the opportunity to send the child to school. If the employee can telework like we did back in March, then they're not eligible either. So that's very important. And you also want to ask, is there anyone else in the family who can take care of the child? So if my husband works from home, he can allegedly take care of the child while he's working from home. And then we need to then look at the position of that individual and decide, all right, maybe they are eligible. Maybe their school did close and they're doing virtual from home. There's no option for this person to send their child to school, and there's no other family around to care for that child and watch over them during the school day. So based on this person's position, do we need to exempt them from these benefits, or should we give them the benefits and move on? So that's a decision that every single organization has to weigh the risks and benefits. And I've had some that have said, we're just going to exempt everybody out of this, and we're going to use our PTO policies and our sick policies. And if they have to go home, they can use their PTO time and their sick time. I've had some that have said, we're going to do it on a case-by-case basis. We might allow our schedulers to fall under this, but we're not going to have our direct healthcare providers be exempt because we need them in the office. So looking at the exemption based upon the position is very important. So you could exempt some positions and not all. I've had some people say, well, our whole company is either exempt or we're not. And really, it's really based upon that employee that's asking for the benefits. Are we exempting them or not exempting them out of the arrangement? Let's go to the next slide. So again, apply it judiciously. Apply it to everybody who's in the same or similar position. So earlier when I said, okay, we're going to allow our schedulers to have this benefit, but we're not going to let our direct healthcare providers have that benefit, then the question is, are you letting one scheduler get the benefit, but the lady who asked for it 2 weeks ago, you didn't give it to? We got to make sure that we're applying it the same across similarly situated employees. We want to avoid any discriminatory claims from employees that, well, we applied it to Betty Sue, but we didn't to Linda Lee, and here's the differences between those two positions, making sure there's no discriminatory reasons. You may want to have a manager and your chief executive officer or your president of your group or your hospital, or have some kind of HR committee make the determination about exemption, so that they actually do the due diligence of, let's make sure everyone who's similarly situated is treated the same. We don't want a favorite of one of the docs, MAs, to be able to get the benefits, but we don't like this MA over here and they've been written up before, so we're not going to give them to them. We cannot have that happen. It's got to be an all or nothing on similarly situated employees. And so that will help us comply with the law and avoid any potential claims that may come down the pike. So the purpose of all of that is really intended to make sure that as a healthcare provider, we are available for our patients, and that all the infrastructure inside of our offices and our hospitals is available to make it operate. We have physicians that may not be direct healthcare providers, but we need them there in the office so we can operate. And in some instances, they still may go home. They just won't get this additional paid sick leave, or they may not get the additional family medical leave for the emergency family medical leave. They may just fall under our normal policies and procedures, or our PTO benefits, or our sick pay. And then in those instances, we have to look at our staffing to determine, do we have sufficient staffing? So next slide. That really brings us to the close of that part of the educational session. I think as we look at the positions, I think all of you, I believe everyone on the line, falls into one of those buckets of a healthcare provider. And Aaron or Jason, I don't know if you can go back to that slide that lists all the different types of healthcare providers, but I think everybody on the line falls into one of those buckets. So that one right there, thank you. So I think you have the ability to use the exemption. Again, treat everybody the same and apply it based upon the needs of the organization. But you are permitted by law to use the exemption. It's not, you're not mandated to have to provide these benefits if you fall within one of these buckets. And so with that, Jason, I see another question. Let me go ahead and just cover that. If a healthcare provider or staff is diagnosed with COVID, but we have a mandatory mask policy for all providers, staff, and patients, is this considered an exposure that we should notify patients and or other staff about, since the CDC defined exposure as unmasked, close contact, 15 minutes or more? So that's really a judgment question at the practice level on the risk side. We have not, I've seen most of the providers, if you have masks, then it's not considered an exposure based on the CDC definition. And so what they've done is made sure the Department of Public Health is doing the contact tracing, but I've not seen the patients actually contacted directly by the practice. And then on the, do we have to notify fellow team members of the illness? So this is a tricky one. You can't just put out an all-user email, you know, Betty Sue has COVID, so if you've seen her in the last 6 days, please let us know. That doesn't work. So if you have, let's say that you're not wearing masks in your office, which I recommend everybody, because of the immunity statutes that we have that are applicable right now, wearing the mask would be good. But let's say you weren't wearing masks. And let's say that your billing clerk winds up getting COVID and they are in an area that has 3 other billing clerks. We should definitely have a meeting where we tell the employees that we know would have been exposed to an individual for periods of greater than 15 minutes to watch for symptoms, wear a mask, take their temperature twice a day, let us know if any symptoms develop. They could also be tested. You wouldn't tell them what employee it was, because you don't want to breach the confidentiality of the employee unless they put in writing that it's okay to use their name. So you might pull in maybe 2 or 3 departments just to educate everybody that, you know, please look for symptoms. We know we had someone who had COVID in the office in the last 14 days. Please take your temperature, take the surveys, let us know if you have any symptoms so that you can be at home, not in the office. And we've used that general statement. We've had someone in the office over the last 14 days who has now tested positive. And because that could be a patient, that could be an employee, that could be anybody, and it helps mask who that individual is. Although I have had people go back and put it on Facebook that it was them. So just trying to protect your patients, your employees. Okay, let's see. The next one is if you have an employee that showed symptoms and had a test while waiting on the results, was paid under the emergency paid sick leave, test came back negative, and the employee was still sick, so stayed out longer without pay. A second test was done and was positive. Do we need to go back and pay for the other days out? So emergency paid sick leave is just the 80 hours. So if they were out for less than 80 hours in the beginning, or if you stopped pay before the 80 hours was up, you'd want to pay that full 80 hours because they would have been eligible. They had a positive test. It was for their sickness, and you already provided them with the benefits. You can't exempt them midway. So I would make sure the 80 hours was covered up to the maximum cap. All right, if an employee is asked by the employer to test due to exposure, is that considered a diagnosis? They can't come back until they get their test. The diagnosis from a laboratory or a healthcare provider, it's a medical provider that would order the quarantine. So the laboratory just getting the positive result likely is not the order for isolation or the order for self-quarantine or for, self-quarantine. The medical provider would normally order that. So I can look into that a little further and see whether or not they'd have to go see a physician to get the order, or if the lab would then transfer it over to somebody else to order the self-quarantine. So I'll get you an answer to that one directly. All right, let's see. All right, I think that answers all the questions so far. Anything else from anybody today? All right, well, thank you guys. I'm glad we were able to get through the session. If you have any questions, you can email me, and I'm happy to help in any way that I can. And Mike, I'm happy to help with those policies as well. I know we have a lot for our healthcare providers.
Gotcha. For any of y'all that don't have her contact info, we'll send a follow-up email out with that information in it.
And again, hopefully, if not today, first thing tomorrow, you can access the PowerPoint as well as a recording on our COVID page on the SHP website. So we should have that up probably by the end of today. And you see the link right there in the chat box as well. All right, I don't see any other questions. Mike, anybody else with any questions before we hang up?
No, thank you, Michelle. I appreciate it.
Yeah, great presentation, Michelle. Thank you. Everybody have a great rest of your day.
Thanks, guys.
Bye, y'all.